Hey everybody, welcome to One Purpose Magazine digital show. I am here with another week of digital commentary. What I do here for the digital commentary on One Purpose Magazine platform is I dive a little bit deeper into the stories that the news cover, that's important to our culture, our community, things that I guess I feel we need to be talking about. So this week I am bringing you or highlighting the stories that I shared in the upcoming magazine. Oh, and I haven't mentioned that, have I? The upcoming magazine, I revealed the cover and I shared one of the profiles that's in the magazine. So the profile you can find on the website or on the social media pages. One Purpose Magazine on Facebook, One Purpose Magazine on Instagram. I have the link tree there that links you right to the article. And the cover, you can do the same. The cover you can find on the social media platforms. And I'm on the cover. Once again, if you don't know, that's what I do at One Purpose Magazine. The ultimate goal in doing that is to hopefully one day be able to highlight uh, stylists in the Midwest area, designers, new new clothing lines that's coming out. Speaking of, I am rocking a Chicago clothing line currently. High end junkie. I was getting my nails done for the cover shoot and ran into a boutique. And I just fell in love with this because I love art, as everyone knows. It's so street art, it's so Chicago. And then to say high end junkie, like I love it. It's so creative. So I was just like, yeah, I got to rock that on one of the shows. So I've been waiting to wear this, okay, t-shirt and trucker's hat. It's one of my favorite combinations. I love a t-shirt. I love a t-shirt with a blazer, but I wanted you to be able to see it, so I didn't put my blazer on. But you all know I love a t-shirt and a blazer, and I love a trucker's hat, especially with my short cut. So anyway, back to the cover. It's been released. I put it out a couple weeks ago, and I'm excited about that. I'm excited about moving forward and finding me a stylist. I think I found someone who I can work with that can reach out to different designers throughout the Midwest and get some looks to design an everyday girl for the everyday body, size 10, size 12, those sizes that people want to act ashamed to claim. But I don't care. It is what it is because I am an everyday sister. This is what it is. So anyway, moving on to some of the topics. That's the update for the magazine. Y'all know I always do an update. And so here I am trying to talk about these topics, right? So let me get back to it. So my first article that I want to I've been working on it still. Like I'm ready to publish it. I thought I was ready to publish it, but it is so in depth and it travels through so many different issues that we deal with. And I went in like a researcher when I started this article, which many journalists do. I think researchers and journalists often our roles kind of intertwine because we discover these stories and we just need to know more about them. And then researchers discover stories and they just want people to know about them. So sometimes you just end up doing it yourself. Like it just happens that way. And we still, I think each field has a lot of respect for the other. So it's not stepping on anyone's toes. I will never call myself a researcher. I respect what they do way too much. But I've learned some great things and some great skills from people who operate in that field. My mouse is acting up on me. So, anyway, the story is drug overdose, alcoholism, and suicide. So I talk about these issues often. as you all know, I have. And so I really did a deep dive into some of the issues and digging into the root of things because that's what I love to do in life, in everything. In my work, I like to dig deep into just explore the reasoning and gain an understanding of why certain things are happening. And I do this because I've learned for myself that when I have an understanding of something, it helps open up compassion. I'm more compassionate towards people who struggle, or who are caught in the nuances of the circumstances that they're in, right? So I'll just read you the lead. I'll read the lead to this story because this is one that I'm about to publish. So over the past few years, we have watched so many of our favorite celebrities lose their lives to drug overdose, whether it was prescribed drugs like oxycodone or illicit drugs like heroin and synthetic fentanyl. Every sudden death takes a toll and reminds us of how fragile life is. According to the Center of Disease Control and Prevention, the CDC, there were 99,543 overdose deaths in the United States in a 12-month ending period in September 2021. Within that same time frame, the Rust Belt regions that we cover for One Purpose Magazine, Indiana, Illinois, Michigan, Missouri, New York, Ohio, Pennsylvania, West Virginia, and Wisconsin had a reported total of 27,273 overdose deaths. That accounts for 36% of drug overdose deaths in the United States. That same region also reported 11,020 suicide deaths, with the state Pennsylvania having the most number of deaths of 1,677, males being the most impacted, with 80% of the 11,020 deaths reported being, that's with the 11,020 deaths reported, males being the most impacted at 80.2%, females at 19.8%, and white and black non-Hispanics were higher than any other race ethnicity group, with white non-Hispanics the highest, with 9,249 suicide deaths. That's a lot. But black suicide deaths in 2020 were 896. Over a 7-year period from 2014 to 2020, the numbers went up. Other than in 2019, it went down a little bit, and I break those percentages down. But comparing 2014 to 2020, there was a 51% increase from 2014 to 2020, with the numbers increasing every year, other than that 1 year within that time frame. So I go in that story and I talk about redlining. I talk about war on drugs. I talk about so many issues and the consequences of war on drugs to mental health, and tying in suicide and just the new story that the new way to handle the fentanyl problem in Chicago. And this is the part I'm still working on in that article because it's new to me. So I wanted to incorporate it into the article. And I reached out to a researcher who did some research on fentanyl overdoses during incarceration, and their findings, and I'm asking them about this new method that Chicago is trying to employ with putting harsher penalty for fentanyl drug related crimes in Cook County. I want to say Cook County. I'm fleshing that out. I'm still getting the details right. But I'm a little concerned about that because of the impact on war and on drugs, and the simple fact that this research found that incarceration for fentanyl specifically is not an answer to resolve it, because they have a fentanyl problem in jails and prisons as well. Um, Fentanyl related deaths, non fatalities in jails and prisons, and many in the Midwest, in the areas that we covered. I was looking at a chart where the incidents occurred, the death incidents occurred, or the non-fatal incidents, overdose incidents occurred, and a lot of them were in the states that I mentioned earlier. So it's just an interesting article that kind of is all over the place, but I'm hoping the conclusion kind of ties it all together and just explain or show how all of these issues kind of fold into one another, and we have to begin to look at things from a perspective of um, all these things are intertwined. They're not one. They're not one within themselves or one on their own. They are all intertwined in creating the issues that we have in a lot of our urban cities, and we have to start addressing them that way. Drugs, mental health issues, addiction, not just drugs, but just addiction. I didn't even go into talking about alcoholism there, but we know that any type of addiction is a coping mechanism. So we have to start addressing that. That's an interesting one. You definitely want to stay engaged with that one. I'm also working on an editorial about U.S. Black maternal mortality rate. I know that it seems like I'm talking a lot about death, right? But because the goal is to try to have longevity and long lives, and so we try to talk about these things as a mechanism of prevention. We want to I want to help do my part in bringing these issues into your awareness, so that when we are going about our lives and making decisions for our lives, that we have these things stored in our memory or in our thought process as considerations, um, to help us just live long lives and be around to change the world. Right? So I'm not going to go too deep into this story. I was excited yesterday when I heard the report that the New York mayor is implementing a program that takes action to reduce maternal and infant health inequities by expanding access to doulas and midwives. I really do think that that's an amazing thing. I really think doulas and midwives are very important, because you have a voice with you that has an understanding of the same understanding as health practitioners, and they can help you through your processes. When you find out that something isn't right or something doesn't feel right, or you're trying to have someone or understand something that you're feeling or you're going through, and it helps eliminate that preconceived notion that some health practitioners unfortunately have about Black women and our endurance. So you have another voice, another person there that can um, stand in a gap when we need them there, and that's very important. So that is a huge thing. I talk about some of the data provided by the CDC. They monitor and they do the surveillance for a lot of our public health concerns. So a lot of data that I use come from the CDC. And what do I want to say about this? This is what I want to say. Over the years, um, we have talked about maternal mortality spikes uh, since I remember. Like, I came into awareness of this in 2018. This is when I was just, and as you would think as a mother that I would have known. Um, but I came into awareness of this in around 2018, right? And so I think that's when a lot of campaigns and awareness campaigns began. And what I have learned is um, not just with Black women, but there has been an overall increase from 2018 to 2020 with I want to say with an overall increase with white. Hispanic went down in 2019. No, it increased. So there's been an overall increase. So I dig into that a little bit more and dig into the reasonings behind that in the article. 2020, the pandemic, it the pandemic did a lot. It caused a lot of stress for a lot of us. And I think that as time goes on, as the years pass, as people begin to use their voices more, I think we're going to learn how the pandemic took a toll in a lot of areas, and especially the data, when the data begins to show us more and more, and we'll be able to see that the pandemic, it really, really took a toll on a lot of people, and the issues that we were already dealing with. It kind of just increased a lot of the issues, from every topic that I just talked about, from drug overdose to addiction issues to suicide, um, to maternal mortality rates. All of the numbers went up during the pandemic, and that's unfortunate. I'm interested in seeing what happens with 2021. We'll see. I also talk about in one of the other editorials that I am doing is Rust Belt City disinvestment. What can economic development look like in the future? This actually, I think, deserves a panel discussion. I'm thinking about doing a panel of experts to come to sit and talk about, or to just have a virtual forum on what economic development looks like in some of these early urban cities that have faced disinvestment. Um, Yeah, like places like Ohio have grown significantly is something that I point out in how people can pursue tech in places like Ohio, um, and can the model there be duplicated? And so, is filming and film studios an option for places like Chicago that has, or any of these in any of these areas? Is winery growing in places like Wisconsin? Are because of the climate change? Is the Are wine venues looking to go to places like Wisconsin? Like, is it a real thing? Is it something that we should be looking into? Um, like, what is the significance of sustaining people and bringing people here? How is that being looked at? How is, like, what can we bring to the economy that could cause people to say, well, it's important, or we should move back? um, Maybe not Black people. And I talk about the migration, the second migration, in the previous video. But just as, like, what can we do to sustain the population, or to grow the population in these cities? Is it something that is being developed as we speak? So that is a good one. I think they are good. That's why I write about them, right? I think they all are good. That's just me. Another editorial that I worked on was, is Black owned and Black targeted media changing the narrative? Okay, so this one is important to me because I talk a lot about Black owned media, right? I talk so much about Black owned media, and we know at this point that there's a difference between Black owned and Black targeted. Black owned is it's us. We invest our money into it. We pay for it. It's us. It's ours. Black targeted usually is like a traditional publisher um, takes one of its brands and targets black people, not owned by us. It's a lot of those out there. Not as many black owned media platforms. But so what I did was I cultivated a data analysis using headlines. And I created all of these headlines and I tried to evaluate or analyze the difference between them using the one around the same topic of violence, right? And I thought that that would be a good one to use because that's one of the areas that we want to start changing the narrative around. We want to begin to see, especially black men, viewed differently. And so I took some of the same topics and I evaluated how the headline was written for traditional news and how the headlines were written for black owned news. And I don't want to, I kind of just want people to read the story. I kind of just want people to read the story. But I will say this. I think that it's very important that we begin to change the formula of how we want our narratives to be told in truth. One thing that we cannot do is own our own and use another owner's formula. For me, the point of being an owner is to create a new path, a new way of doing things. If that's not what I'm doing, then I'm just a worker. I'm working their method just under the umbrella of my own platform. So I encourage Black owned media to brainstorm, to think of ways that we can present our news, our information that is not using the formula that has already been written for us. Um, it takes some creativity. It may take some backlash. And I understand that change is hard. Change is very, very hard. And to get people engaged in your information in a way that they're not familiar with it takes a lot, you know. Um, but we have to do it. I know, and I understand headlines are clickbait. Headlines of what draw people in. But you know, it's the clickbait, unfortunately, that's shaping the narrative. People are not going in depth and reading stories. Um, not in a large on a large scale. You know, what gets shared, what shapes thinking, what's out there is that first headline, that first piece, that first initial introduction to what your point is or your message. So I think that we have to start thinking about that if we really want to change the narrative. It's one thing to say it, it's another thing to actually do it. And that takes courage. That takes changing how things are done traditionally and stepping out and really being innovative in what it is that we do and reshaping how people view a culture that we have so much love and respect for, ideally. Because let me just put this out here. Y'all blowing my mind on how you all are speaking about my girl, Judge Ketanji Brown. I am highly, highly, highly disturbed at how black people, are coming for her. And it's very disappointing. And I'm not saying that we are not going to agree with every little thing that each other, that you do, that I do, that another person does. We're not going to agree with every detail. But one thing that we know for sure is just because of the color of our skin, the journey was not easy. And I don't care who you marry, I don't care who you grow up with, I don't care if you were in a cul-de-sac or if you were on the block. If your color, if you have melanin in your skin, your journey has been difficult. And if you go to the heights of careers in this country to the point where you're sitting on the bench as a judge, you as a black woman have faced so much. Like, you have to do something. You know what I'm saying? Other black person, other black people, you have to have done something. If it was become a manager at a fast food restaurant, I don't care what you have done. You have had to try to accomplish something to understand the depths of the backlash, the depths of the the racism, the depths of the just these so I just think of so many words that they use, and I just it's so frustrating. Like, if you ever tried to climb, you know what I'm talking about. You just those underlying things that people say but they don't say, the things that people do and they try to act like you know it's normal. They normalize their insanity and just assuming that just these assumptions that you're I can't even go into it. So many things come to mind, but we have to stop. If you have tried to do anything, you know that that woman have had to go through a lot. And for us to be as vile and disrespectful, all because we were able to get a social media platform. And that's what it is. People have followers on a social media page. And the first thing they do is see another successful black person and they tear them down. Now, you know what? This is house business. I usually don't want to use my platform for cleaning house, but it has to be said. Y'all got to stop. I want to call some people out because I follow you and I respect you, but I won't do it. I'm just going to say that y'all have to stop. It is just sad and ridiculous. But I'm going to move on. I'm going to move on. So that's that. So I am going to end my highlights with my profile. I did a profile on Miss Lydia Brown. She is from Chicago. She is a light to the world. She has a very interesting story. She has written a book, a poetry book, that is strengths and weaknesses, hope through prayer. So hopefully you all go to the magazine, click on profile, and read Lydia Brown's profile. And cop her book. Read, get her poetry book. Check it out. Read her story. Listen to the podcast. We got a few giggles in there, because she has a really deep story. But it's really really a really just truthful, honest person who I believe is one of those people that voices are looked over. And so that's one of my roles in the many things that I do is discover these voices and bring a platform to them that gives them the space to tell their story how they want to tell it. And that's what I do. So check it out on my magazine at onepurposemagazine.com. I think you will enjoy it. With that being said, I have one more thing that I want to talk about. So you all may not know this, or you may know this. I'm not a huge reality show person, but some of them I really do watch. And I was very reluctant to watch Kandi and the Gang. I was just like, not another reality show with drama, drama, drama. But I have to say, I watched all 3 episodes this past weekend, and I was very touched. I was very, very touched by one of the castmates, especially. His name is Brian. Check out this segment. This. I was just bringing light to the fact that we're going to hear a lot of stories about what people went through during the pandemic and how hard it was for a lot of people. And on the other side, somewhat on the other side, now, not only are we hearing the stories, but I think that we have to operate in the area of compassion and understanding that everybody's not going to be willing to tell their stories. And so I think that collectively as a community, we have to employ a bit of compassion for people and understanding that folks deal with real issues, like real issues. People deal with real life issues, real life circumstances. And some of the things that come with real life circumstances are addictions, mental health crises, mental health issues, just a lot of circumstances that makes life complex and that we have to overcome. And it's not always easy to overcome these complex circumstances. So giving the giving the issues a voice, giving the issues a face is so important because people have to know and understand that they're not going through things alone or they don't have to live in the stigmas that we create that, addiction looks this way or addiction looks this way. And but I'm a working person and I'm someone who's striving for greatness. So, you know, I don't want to be open about this issue because people are going to think this way about me. I totally respect and appreciate Kandi and her team in Bravo for giving Brian the platform to tell his story. And even more than that, Brian is a hero for telling his story and sharing it in the way he is an example, just a great example of an overcomer. And his story really touched me because I talk a lot about um, these issues from the point of lives lost. And for me, those lives lost, they need a voice to help people. But he was able to um, get another chance and tell the story himself. He was able to get another chance and shed light on some issues that so many people are going through with addiction and mental health issues. So I appreciate that moment. I appreciate the platforms for using it in the way that they did. And I just want to see more of it because we have to heal. We have to heal. And on that note, I just want to say that this magazine has been um, dear to my heart. Um, Going through these stories and uh, telling these stories and doing the profile on Lydia has really reignited my passion for this. And I am looking forward to just diving in deeper and talking about these issues and connecting with people and with, that's like minded and just doing the work. And oh, before I wrap it up, now I talk about the issues, but I also like to have fun. All right. I like to have fun. I like to live. I like to do things within proper guidelines for health reasons. So I talk about I talk about thrifting because the outfit that I used on the cover of the magazine was all thrifted from Goodwill. Let's see. I talk about some of my favorite things. I talk about some of my favorite foods and restaurants, and it's me. But I'm highlighting other things that belong to other people. It's just me doing the work. Um, let's see. Oh, and I do my bourbon and conversations, cocktail mixes. I talk a lot about bourbon and the bourbon industry and what that means to the Midwest, and I shared some of the health guidelines on healthy, not maybe not healthy. I don't know if I want to say healthy, but um, appropriate guidelines for alcohol consumption. I do believe that if you're going to drink a cocktail, you should put 1.5 ounces in that cocktail. And there's a limit on cocktails that you should drink. I have that in the magazine. You know, we can also still have fun within, guidelines and enjoy life. We don't want to take all the fun away. We don't want to pretend like we all have to live this perfect, well, morally correct, because what is that anymore? Is there such thing as moral correctness anymore? But I mean, because we see people who establish moral correctness and what they do. Child, that's a whole other show. But anyway, I talk about all the fun things too, um, minus dependency. So we do have to care about people, but we have to be able to live our lives, which is it's a very fine line. But we straddle it. We straddle the fine line because we believe that human being a human is complex. It's not it's not just like a one lane road to anything. So it is what it is. And I don't know why I did my whole show with my elbows on the table and my hands flying around. That's just crazy. I don't know why I did that, but I did it. It's over. I'll see you all next week.